Episode of Nurses with Voices. I'm Dr. Lindra, and I want to talk about something that has been hot in the news right now. So, in the news, you may have heard about the insurance CEO who was recently murdered. And, listen, I want to start off by saying that Nurses with Voices does not condone any type of violence. I just want to talk about what I want to talk about really is the decision of the Anthem Blue Cross Blue Shield decision to limit anesthesia coverage based on predefined durations. Now, I do not have all the facts, and I'm not sure if one has anything to do with the other. But the reason why I bring up the unfortunate event is because it's almost like our healthcare system in the US is so broken, and it's almost like people are taking matters into their own hands. And when you have insurance companies making decisions such as what Anthem Blue Cross Blue Shield recently the decision that they just recently made, people are taking things into their own hands. And it's almost like there's massive people on social media, like the mean things that they are saying in the comment section about what has happened to this healthcare CEO. The comments are just they're pretty dicey. More than that, I'm probably being with the words that I'm choosing to use. But I mention this because for a few reasons I bring this up, and I think it's an important topic to discuss. Healthcare and healthcare workers have become so disposable, and I want to make the connection between these type of policies and decisions, and I want to make the connection to our healthcare workers, to our um, to our healthcare system, right? And I want to make the connection how it leads our healthcare workers to burnout, and why so many individuals are exiting the bedside. So now, I should lead with saying that Anthem Blue Cross Blue Shield has since halted their decision to move forward with this anesthesia limit. But again, that decision does come timely with the execution of the insurance CEO. Now, just going back to what what coverage means, or so basically what it is that the insurance would have been covered up into a certain time, for a certain time frame, while someone was under anesthesia. Now, putting such policies into place, and this is what I want to have, right? Basically, the policy may inadvertently create pressure on surgical teams to complete procedures within arbitrary timeframes, prioritizing financial considerations over clinical judgment, right? So now this is where things become really dicey. So I want to make sure that you guys hear me with this. So sorry about that if my mic wasn't closer to my face. Because this is where things become really dicey. And from a nursing perspective, this policy mirrors issues related to nurse sensitive indicators that are tied to reimbursement, such as hospital acquired pressure injuries, falls, catheter associated urinary tract infections, which must meet specific preventions or treatment benchmarks before hospitals to receive full payment, right? So nurse sensitive indicators reflect directly patient outcomes directly impacted by nursing care, right? So basically, and this is what in the hospital they call quality sensitive indicators. So in many cases, hospitals face financial penalties if these outcomes do not meet expected thresholds. So for example, pressure injury prevention. So nurses are expected to turn patients every 2 hours while they're in the hospital, and turn or reposition patients within prescribed timeframes, right? Every 2 hours, as I mentioned, or less, depending on the patient or the situation. And so delays or inadequate documentation can result in non-reimbursement. Now, let's unpack that. There are so many variables that can affect that. For instance, staffing can affect that, and this is what I mean. I know, and staffing is one of those topics that can be an entire episode all by itself, right? Staffing can definitely be one of those topics that just can be an entire episode. But the reason I mention it is because, you know, if you have let's say you have a nurse who's 5'11" and about, I'm sorry, 5'1" and about 95 pounds, that she's taking care of four 200 to 300-pound patients, and two of her 300-pound patients need to be turned every 2 hours. Now, that nurse needs to have resources. She needs to have, and this is where staffing comes into play. Does she have the staffing to turn those patients? Does she have the safe patient handling equipment to make sure that those patients are turned appropriately? So is is the safety handling equipment broken? Are the foot boots available in the hospital? So are we giving our healthcare professionals, our nurses, the tools and equipment that they need in order to do their job effectively? So this all ties into staffing. And then let's just see. And if they're short staffed in central supply, and then guess what? We can't bring that up for until the next shift. Or if they're short staffed on a unit, we only have one nursing assistant. The nurse cannot do everything. And you know what? And the part of the problem is many of us feel like we can and we do. And that's part of the problem. So then that also leads to injuries, right? Our workplace injuries. So there's so many variables when you start to unpack these things as to what can happen and all the consideration, but I'm not going to say no one, but you feel like no one does. And this is where our healthcare professionals and our nurses are left to feel. They're feeling like no one really listens, or no one really pays attention, or no one is really hearing them when they're saying, oh, we need staffing. And think about it, when you have, and I had my episode with Dr. Badia actually talked about reimbursement, and we talked about authorization and how we have individuals and working for these insurance companies who are non-clinicians, right? And they're non-healthcare professionals, yet they're making decisions that affect healthcare professionals and us ultimately affecting patient care, and it's affecting the care that we give. So these things are so important. And this is why I say that there's a ripple effect that really occurs when healthcare decisions are made. And I want to say bravo to the governor of New York, who really, I know she made a comment about how ridiculous and outlandish, and I'm putting my own words into what her comment was. But this is how we affect change. And yes, the Blue Cross Blue Shield, they did put a hold on they halted their decision, but everyone got involved, from social media to the View to the governor to, like, this is why I say nurses really need to have a voice. But I'll get to that as well, because I don't want to go too far into down a rabbit hole and miss my point. The other thing, when we talk about outcomes, nurses are expected to have timely documentation of care. Now, the nurses must document specific aspect of patient care, right? For medication administration, wound care, you name it, with set timeframes to ensure compliance, again, of reimbursement. So let's go back to that pressure injury prevention. Nurses have to document that pressure injury prevention, because if you didn't document it, what happens? You didn't do it. So now you have to document every 2 hours to make sure not only that you're turning the patient, you have to document that you did it, because you may know that you turned the patient, but what happens is if they go to the documentation and they don't see it. So where are my legal nurse consultants, right? Like, that is a sure way your documentation is one of the things that gives legal nurse consultants a job, right? Because we go right to the nursing documentation. And if we don't see where you documented something as like a CHG bath, even though you probably did it, but or maybe you didn't because you didn't have the staffing or the resources or the tools and equipment to do it. And if you didn't document it, and if that patient got an infection, or if that patient received, in the case of pressure injuries that we're talking about, if that patient received a pressure injury and you didn't document that you turned the patient, now you're liable. So guess what? So now, again, these are all of the things that, you know, causes undue pressure and more pressure to the nurses. Now, some people may say, well, that's part of your job. That's what you were trained to do. Well, I'm going to challenge you and say, are we really educating our nursing staff on what documentation should look like? Now, as a healthcare executive leader and someone who's been a nurse for over 22 years, I think, and this is my opinion, we have gotten very, very loose with what charting by exception looks like, right? And so I can remember when we first started charting back in my day, when we were still hand charting, we did have, we would talk about chart by exception, but there was a lot of hand charting. So you charted in a lot of places, right? So electronic documentation did help with, it did take away all of the charting that we used to have to do, because now a lot of things are a click away. But that doesn't mean that you still don't chart. And I think we've gotten away from charting certain behaviors or charting certain things that we see. And we've gotten away from that because we're relying a lot on electronic documentation. Yes, it is meant to, be a support, right? It is meant to eliminate a lot of the back and forth of the charting and documentation of the paper charting we had to do. However, I think there isn't we aren't well educated on what charting by exception looks like. That is my main point. And and one of the reasons why I say that, because I've seen far too often the person or the people who are educating our nurses with during onboarding are not clinicians. They are IT people who have put together the program, but they do not have a clinical background. They're basically educating you on what the documentation system looks like. Does that make sense? They're not necessarily, because they don't know. They don't know that you should be charting on a neuro patient with neuro checks every 2 hours, right? You should be charting those neuro checks every 2 hours. They don't know that. They're going to tell you, oh, you follow your doctor's orders. The doctor's order may not necessarily say certain things that we need to document. So, and the doctor's order may not say, oh, CHG bath every shift, right? Or certain behaviors, or ambulate the patient to the bathroom. We shouldn't need a doctor's order to say ambulate the patient to the bathroom, right? Every shift. Now, certain things we should be charting. And what happens is the people who are educating us on these electronic documentation systems are not clinicians. So this is why I challenge us when we talk about documentation. Are we actually educating our nursing teams appropriately on how they should be documenting? And, and all of these things, they really put more and more these reimbursement linked time sensitive metrics. They parallel the Anthem decision in several ways. You have increased workload and stress, right? Nurses and surgical teams may feel pressure to complete tasks quickly to align with coverage constraints, right? Now, this can lead to cutting corners or overlooking critical steps in patient care or documentation. And then you have to look at the impact on patient safety, as with nurse sensitive indicators, as a focus on meeting time constraints rather than holistic patient care. And then you have, so listen, for example, you have patients with may be at increased risk of errors, right? Delayed interventions or adverse outcomes. So, for example, rushing a surgical closure to meet the anesthesia coverage limits could, possibly lead to incomplete hemostasis. And so there's so many variables that can go into these things, and Moral distress is the third thing that I just want to mention. Nurses may feel torn between adhering to these external metrics and providing patient centered care, exacerbating burnout and job dissatisfaction. So, the broader implications that you really want to consider, this anthem policy could exacerbate an already strained healthcare system and environment, I should say, where financial incentives are tied to rigid metrics. And nurses are critical advocates for patient safety, for their outcomes, and policies, right, that prioritize reimbursement over safety fundamentally conflicts with nursing ethics and their ethos of care. So my recommendation, when you think about what can we do, right? Healthcare organizations and nurse leaders must collaboratively advocate for policies that balance efficiency with safety. Because what happens is you feel like you're placed in a position where, and again, I'm speaking from a leadership perspective, right? Because in my experience, and may not be everyone's experience, but in my experience with leadership, if this is what is this is what we're told to do, we make it happen. And unfortunately, it puts undue stress on a healthcare team. So we have to have that emotional intelligence to be able to step away or walk away or challenge, I should say. We have to have that emotional intelligence to be able to challenge what we're being told because listen, if this is going to affect the hospital's reimbursement, those boards of trustees, they're not clinicians. They listen, if this is what this is what our healthcare system is saying that we need to do, that's what they're going to do, unfortunately. So now what they're going to do is they're going to create a process and they're going to create a plan so that to make sure they're going to educate everyone and give them the why. And it's not going to make sense to anyone and no one's going to fight it and no one's going to challenge it. But I love that in this instance, people did come together. And if you see the political, the fact that you have politicians saying, wait, no, this is crazy, because guess what? It was affecting their states. They spoke up. And this is why I always say, we nurses, we need to have a voice at the legislative level, not just, amongst ourselves, not just in the break rooms. We really need to have a legislative voice to talk about and discuss what's taking place so that there's a good understanding as to why something shouldn't happen, and so that we can advocate appropriately and not burn ourselves out. Nurses should be empowered to participate in these decisions or in the decision making processes that address these systemic issues and ensure patient advocacy remains central. So in order to do that, we really need to continue to collaborate. Need to continue to make our voices known at the legislative level. And then also we need to understand and see what can we do for ourselves. And this is why I put together events like the Health and Wealth Expo, right? The live summits, the virtual summits, all so that we can educate ourselves on what wealth looks like, or what being able to provide self-care, wellness care to our patients, being able to do these things and doing them with peace of mind, and being able to transfer our skills and not be so burned out. It's time to break away from the rat race. It's time to break away from a system that is so very broken, that is causing so much ripple. And I know some of the things that I'm saying, I'm probably going to catch a lot of flack. They're probably going to seem controversial, but this is the problem with our healthcare system. No one wants to listen and no one wants to challenge what's happening, what's taking place. And it just leaves us to really start to take matters into our own hands and say, you know what? all right, this is what I'm going to do. I'm going to start my own business, right? Or I'm going to invest in myself. What does that investing in myself look like? Okay, but guess what? I don't know how to invest in myself. I don't know what self care looks like. I don't know what self care advocacy look like. This is why it's time to get into rooms like the Health and Wealth Expo Live Summit. And this is, like I said, all of this really comes timely because this is why I put together these type of events so that when we think about the ripple effect that decisions have within the healthcare system and how they can have detrimental effect on our health, our wealth, our well-being. Um, think about the patients in the community. Think about how they're now affected, right? So let's just say this policy went into place. And now we have someone who their surgery, the insurance company says their surgery should take 4 hours due to some complications or due to some things where the surgeon was, being extra careful because they had to for whatever reason. Their surgery took 6 hours. So now you're going to only pay that hospital for 4 hours, but now the rest of it is left on the patient to pay. This is why people have insurance. And this is why our healthcare system is so broken in the US. So I say all this to say we really start educating ourselves. This is why when I end my Nurses with Voices podcast, you always hear me say, stay educated, stay inspired, and stay empowered, right? And that's how you do it. You do it by starting to get into rooms like the Health and Wealth Expo, joining organizations, really positioning yourself and educating yourself so that you can make beneficial decisions for yourself. And this is also why I am, and now more than ever, I'm putting together my 12-week program that's going to start in January. And it's really all about helping you to reset your mindset so that you can really prepare yourself for that transformation that you need so that you can break through from burnout. So I thank you guys for joining me. Thank you so much for listening in. And I hope this is helpful in understanding how when we place profit over patience, this is unfortunately what happens. These are the detrimental effects that can happen. But just know there are events like the Health and Wealth Expo that you can join. There are organizations that you can join, and it's really about educating yourself, guys. So until next time, make sure that you stay educated, stay inspired, and stay empowered.